We are expecting that by the end of this month, the Supreme Court will make a ruling on up to at least 7 issues that they're contemplating on the constitutionality of the Affordable Care Act. We are not projecting what those rulings may be, but whatever they are, they're going to change the rules of the game. And legislators and states have to be ready and prepared to provide the consumer with the implementation that the law is going to require. No issue in the past 20 years has been more toxic than health care reform. It has defined politics as we know it today. To avoid that kind of extension into the next couple of years, Senator Bolcom and I are asking the governor and legislative leaders to convene a meeting, a summit, if you will, of legislators, stakeholders, which include the providers, insurance executives, and hospitals, and consumers, to talk about what Iowa needs to do over the next year to implement whatever is left with the Affordable Care Act, whether or not it is intact entirely or that there are some changes. Iowa has had a history of having a bipartisan approach to health care reform. Over the past 5 years, there have been a series of major reforms in the state. One, pushing Iowa to the top of health care coverage for children, where nearly 98% of all children in this state are covered by public and private health insurance, highest in the country. We want to take that kind of success, that kind of work, that kind of bipartisanship, and make the Affordable Care Act, which is really about gaining and giving access to adults in this country to the best health care delivery system. The Affordable Care Act in the past and the federal government in its deliberations have acknowledged that states will play a major role in delivering this kind of service. As you know, Governor Branstad was one of 25 Republican governors or attorney generals who sued the federal government, which is now being played out in the Supreme Court. We need to have his kind of leadership and our kind of leadership in the legislature to be working together with the hundreds of stakeholders that have been clamoring for a better health care system for the state. We do not want to fall into the partisan politics that this issue has pushed us into so far. Too much is at stake. Children need to be covered, adults need to be covered, small businesses need to have the incentives that the Affordable Care Act gives them on tax credits so they can provide health care to their employees. Children who are still under their family policy needs to continue. Adults with pre-existing conditions that can't get any kind of affordable care presently need to be brought into the system. We need to have accountable care organizations and medical homes. We need to have a coordination of care that the Affordable Care Act designs for us. I don't think there's much debate or deliberation that we need to change. And there's a lot of agreement on how we have to do it. The disagreement comes in how we pay for it and who controls it. Those issues are going to continue. So I'm calling on Governor Branstad and the legislative leaders, both Republicans and Democrats, to convene a summit shortly after the Supreme Court rules so we can begin to provide the services needed for the next legislative session.